Dr. Zhitnitsky, we did just finish a communication about sleep apnea and literally what I call, devastating effect. I mean, you really enlightened me fantastically here, because if you lose sleep at night, which apparently what you said, tremendous amount of people do, to a dangerous level where you get so little oxygen that every doctor in every emergency operating room would have all the red lights going off, and yet people sleep below that, and then they wonder why they fall asleep at the car, and even if it's not that drastic, but they just feel a little lifeless throughout the day. And on a long run will develop all kinds of symptoms because of it in all kinds of body parts, because it's just not good. Now, you did mention that the CPAP machine, which is a machine which basically pumps I think air, just normal air into the airwaves, and by doing so one breathes. But you also mentioned that really a dentist makes some appliances, kind of like a mouth guard, just to give it a rough definition, and explain to us why it is a dentist and why that mouth guard, despite the fact that the gold standard might be the CPAP machine, why the mouth guard plays such an important part in it.
The CPAP is the gold standard, provided you use it. A lot of people can't use it. And if you're not using it, even though you have it at home, it's not helping you. Some people get claustrophobic with it. Some people throw it off at night. Some people don't take it with them when they travel. It's a very bulky item that needs to be hooked up to electricity.
And you have a hose coming out of it, right?
Right. So
a guy
gets very loud.
It's loud also?
It can get very loud, so your spouse may be complaining with the machine working in the bedroom, which may be still quieter than your snoring, but still loud. That's where the dentists come in.
I see.
We're capable of making a special appliance that keeps your jaw in a position where your tongue doesn't fall back and obstruct your airway. And it's a very small appliance. You can take it anywhere. It's like a mouth guard, something that the athletes would use. It's very comfortable. You can talk with it. You can take a sip of water with it. You spend the whole night with it. You don't toss it out. And if you can't get yourself to use a CPAP, or a CPAP is not available, this is your next best choice.
Okay. Wow. So basically, and mainly the CPAP, is that, people, they toss and turn and they just don't want to sleep with that, huge bulky thing around. And once they don't use it, it becomes useless. Because like sleep apnea is not something you treat, sometimes. It's like with glasses. If you see, you see. If you don't see, you don't see. So if you put glasses on, you see. If you take glasses off, you don't see. Simple, right?
Absolutely. Once you have sleep apnea, you have it for the rest of your life. And it has to be controlled. You can't use it sometimes. And nowadays, what happens is that CPAP machines, they start putting in counters that measure the number of times you use it per week and the amount of time you use it per night, and they found out that very few people use it constantly. They forget, they come home from a party tired, they don't feel like putting it on. They have to get up early the next morning, they don't feel like putting it on. It's, in fact, CPAP is being used only 30% of the time when what it's supposed to be used.
Right, and every time you don't use it, you can wake up anything between, 40, 50, 100, 200 times a night, and have a half a minute to a minute of sleep deprivation, which doesn't sound so much, but it's like oxygen deprivation, really, which is the key, stop. So basically, it's almost kind of like, let's just compare it with the potential of being shot, kind of like, I don't wear my bulletproof vest when they shoot at me sometimes. I wore it yesterday, but not today. But they're still shooting at you, so you'll die. I mean, you don't always die, I guess, from these things, but you get that stuff, so you've got to wear it. So basically, what you're saying is, so if you have this mouth guard, you're not pumping in any oxygen, but you're opening the flow of oxygen, and you're not having any...
It does not let your airway close.
Mm-hmm.
So you're breathing normally, like you'd normally breathe in your sleep as if you didn't have sleep apnea.
Mm-hmm. So why is the machine still considered the more golden standard if you don't have it anyway with the dental appliance which you make?
Because if you wear it, there's 100% certainty that your airway will not be closed and you will get enough oxygen.
Mm-hmm. And with the dental appliance?
With the dental appliance, there could be certain instances where you may close. It might be a little less, but you're still going to get enough oxygen with a dental appliance,
mm-hmm.
and it's still going to give you a full night's sleep.
Okay.
But,
all right.
And maybe it has to do with the fact that physicians developed it and not dentists.
Yeah.
Because physicians don't think in terms of a moral appliance.
Okay.
They think of a machine that'll pump oxygen into your lungs.
Right, and also I'm very sure physicians don't make the machine, other people make it, and they do cost some money. Would you say that the dental appliance is a lot cheaper?
Oh yes, it's much cheaper than a CPAP machine. Many medical insurances cover it. Wonderful. If you're documented that you have a trouble using a CPAP machine, then your medical insurance will pay for an oral appliance for you.
Absolutely great. Well, as a friend of mine whom I asked in terms of sports once, as you know, he's one of those sports teacher, coach type of people, and I said, what exercise is the best, Georgie? And he says, Helmut, the best exercise is the one you will be doing. And that reminded me when I was in Austria cruising around and trying to get to a girlfriend, and the mountain was snowed down, and I had to, oh my God, it was like a 7-time bigger, longer road to get there. But the point was, I wanted to get there. So that longer road was the perfect road to me because it was the only way. And so it looks like if people don't wear this the CPAP machine, if they for some reason have trouble financing it, then very obviously, even if it is true that this is the second best, which is not totally proven based on what you said, at the very least, it is something, it just became the best because they can and will do it.
You're absolutely right, Helmut. It's much easier to wear an oral appliance that doesn't require any electricity, doesn't require any hoses, masks on your face. It's much easier just to pop it in your mouth and go to sleep.
Good.
And chances are you will be wearing it.
Wonderful. And so and that's the key, really. That's really the key. So basically, if a person has some of those symptoms, kind of waking up slightly tired, getting tired, snoring, things like that, you said maybe an extended neck, all kinds of symptoms he might possibly have, but being more tired and exhausted than he wants to be, and snoring are the two major type of things you should look for. Would a dentist be a good first stop to go?
Oh, absolutely. If we're trained in dealing with sleep apnea, we can provide a certain screening and then refer a patient to a physician for a complete diagnosis.
Great.
Absolutely.
Dr. Zhitnitsky, thank you very much. Bye-bye.
Thank you.